This is the Medical Minutes Podcast on the All Indiana Podcast Network. Your source for the latest news, updates, information, and more from the world of health and medicine. Now, here's Wish TV's medical reporter, Dr. Mary Gillis.
From Wish TV, I'm medical reporter Dr. Mary Gillis, and this is Medical Minutes on the All Indiana Podcast Network. September is Suicide Awareness Month. As part of that, Wish TV will air a Health Spotlight special Thursday, September 22nd, focusing on suicide awareness, prevention, and how it affects minority communities. I had the chance to sit down with Wish TV medical expert and former Surgeon General Dr. Jerome Adams. We spoke about the difference between mental illness and mental wellness, the reasons why minorities are more susceptible to suicide, and why doctors say implementing the 10-minute window can save lives. Our conversation is next. Dr. Adams, great to see you.
You too. Great to be here.
Okay. Well, all right. Just want to start off with the pandemic. It played a major role in the increase in suicides for all groups. Why do you think the black men and black children were more affected than other groups? What drove them to suicide, and are there reasons different from what drove other groups?
Well, as you mentioned, we've seen suicide rates increase, particularly for African Americans and for African Americans between the ages of 15 and 24, where it's now become the leading cause of death. There are lots of thoughts as to why that's occurring, but one of the main reasons is just stressors. We know that African Americans, unfortunately, are constantly traumatized. When you live in a community where there's violence, when you are facing racism, and we have to remember that during the pandemic, you had the George Floyd situation, you had the Ahmaud Arbery situation, you had so many things occurring that were on the media all the time while we were home watching TV that were traumatizing people over and over again. You also have to understand that African Americans don't have easy access to the healthcare system, much less access than the United States in general. And an inability to access the healthcare system means you're not being screened for mental health issues. It means you can't get treatment for mental health issues. And then speaking of mental health, I think a final important point is that there is a real stigma against acknowledging mental health issues and promoting positive mental health in the Black community. And so we need to tackle all of those issues. We need to tackle racism. We need to tackle stigma against mental health. We need to increase access to health care. And we need to make sure we're dealing with the systemic issues, the societal issues that are constantly traumatizing people.
I want to talk about the being traumatized, in terms of George Floyd in that summer where this whole Black Lives Matter, all of these things that came out, was very sort of charged for many black individuals. Does someone embrace this and look at this and internalize it and say, this is going to be me someday. This is just the world that we live in, and there's nothing I can change about that.
Well, what's interesting about suicide and the connection between those events and potentially higher suicide rates in African Americans is that we know suicide comes when you have a loss of hope. And if you're watching people who look like you, who live in places like you live, constantly losing control of their environment, being chased down and shot, as was the case for Ahmaud Arbery, having a knee put on his neck, as was the case for George Floyd. Those are situations where you start to feel like, well, gosh, I already don't have a lot of control in my life, and I see that out there that I don't have any hope for regaining control in my life. And so that's a part of it. But as you mentioned, we also internalize that trauma. We're being traumatized every time we watch those videos. And I had to personally check myself and stop watching the videos over and over and over again because I think it was affecting me. It was affecting my mental health to see that happen. You start to internalize it.
Well, that's so interesting that you say that for someone who's so educated and an advocate of this, that even you found yourself that you had to stop and take a break from that. But for someone who doesn't even know what might be going on and how this might be affecting them, and they might not be aware, they wouldn't know to take a pause, and they would just sort of, have it keep infiltrating their space, and it sort of builds and builds.
Well, they wouldn't know to take a pause, and they might not be able to take a pause. So one of the other challenges that we have is just the nonstop media out there. We've got social media, and you're seeing it over and over again on your phones, on Twitter, on Facebook, on Instagram, being replayed over and over and over again. And as I mentioned during the pandemic, because people were at home, they were on screens more than ever, whether it was TV or whether it was their iPhone.
I do want to talk about solutions, but I also really like the point that you raised in terms of the social media effect. I mean, we already know social media is like in our face all the time. What can kids specifically, because we're talking about 15 to 24-year-olds, I mean, they're the dominant social media users that we have, to get away from that when it's such a part of their culture?
Well, I think one of the things we need to understand is, like anything else out there, there's good and bad that can come from being online and from having access to social media. It has really increased people's ability to get to information. It's democratized information in a way that I think is helpful for minority communities. But too much of anything can be a bad thing. And so we need to do more research, quite frankly, to understand the impact of social media on people's mental health and on their educational health and on their physical health. But we also need to help people understand what we do know. And we do know that the areas in the brain that light up when you take a puff on a cigarette or when you actually are using heroin are the same areas that light up when you pick up your phone and check your social media accounts. And so you can become addicted to social media. It can change the way your brain is wired. And once we understand that, once people understand that, then they understand why it's important to take a break themselves, or if you have a kid, to encourage your kids to take a break. One of the things that I did in my family was tell my kids, look, after a certain time at night, we're putting the phones down. We're putting the phones down so your brain can kind of unwind, and so that you can go to sleep without being so revved up.
Wow, another unhealthy addiction that we're sort of dealing with. You talk about mental health, or you're talking about mental health as a whole, but I want to sort of talk about the difference between, or let's say, is there the difference between a mental illness and mental wellness? So can you talk to me about the difference between the two? I mean, mental wellness, you don't necessarily have to have a psychiatric disorder to struggle with mental wellness. Mm-hmm. So can you speak to that?
When we talk about mental health, when we say the words mental health, far too often people think we're talking about mental illness, or in many cases, we are talking about mental illness. But mental illness is just one end of the spectrum of overall mental health. As you mentioned, mental wellness is on the other end of the spectrum. And just as you can say you're obese and you need to lose weight, or you say, I'm fine, but I want to strengthen my muscles so that I'm actually more physically fit, we need to understand there are things that we can do to strengthen our minds and to strengthen our mental health, even if we don't have a mental illness, and they will decrease the chances that we have a mental illness. But we also need to understand that sometimes you really are sick, you do have mental illness, and you need to feel comfortable going to your doctor, talking to your family, expressing the fact that you need help so that you can get the help that you deserve. We wouldn't feel ashamed to tell someone we rolled our ankle or that we were diagnosed with cancer, but we feel ashamed to tell someone that we're anxious and we're depressed. And that's what's really, I think, feeding at its root the mental health crises and the suicide crises and the opioid and addiction crises that we're seeing out there, the stigma attached to people promoting mental health and wellness and acknowledging mental illness.
Well, I like the example that you used, instead of you sprain your ankle or you fracture your foot. You can go to the doctor, you see the x-ray, you see the injury, your doctor says you're going to need a boot, you'll be in the boot for maybe 6 to 8 weeks, this is your recovery. Do you think part of the stigma and sort of the confusion around mental health is because it's not something that we can see? We don't have a piece of paper of our brain saying these chemical receptors are not sort of being, we don't have enough of these or we don't have enough of that, that we can't show someone and say, this is what's going inside my brain?
That's a great question. So in 2020, I put out a call to action when I was Surgeon General on suicide prevention. And one of the points that we emphasized in that call to action was the need to better train providers and prepare healthcare systems to screen people for mental health. There are evidence-based tools, just as there are to identify whether or not you have high blood pressure or diabetes, to identify whether you have or are at risk for depression, anxiety, and suicide. And the more that we can normalize that as being part of your overall health care, and then actually demonstrate to people that, hey, you're just like so many other people out there, but we also have treatments to help you get better or to help you deal with your mental health issues, I think the more people will be receptive to that idea.
I'm so glad that you brought up your call to action, implement national strategy for suicide prevention, the report that you published. You focused on several key things. So I want to you to tell me how much progress we've made in each of the areas that you've highlighted, especially as it relates to the Black community. So you talk about help other people build the skills, coping, problem solving, and resilience. What do you mean by that, and how's it looking?
Well, just as we talked about with mental health, you can have mental illness, or on the flip side, you can build strengths. We know that people who are at risk for suicide, actually, you can work with them and build protective mechanisms by increasing their networks, by giving them a sense of purpose. And so what we want to do is continue to emphasize to people that, hey, loneliness can lead to suicide. Lack of purpose in your life, lack of a job itself, when we're so attached to our careers, can lead to suicide. So connecting those folks. Interestingly enough, we've seen in the veteran population that their rates of suicide go up precipitously when they leave the military. Why? Because they've lost their sense of purpose and they've lost their sense of community. And so there are real efforts in place, and successful efforts, to build community around those individuals once they separate from the military, and they've been shown to lower the chances someone will die by suicide.
Right, having that community just being cut off and having nowhere to go, so sort of having them to sort of go to another place. And right, I mean, you talk about having a contribution to life, something they've always known, and their buddies who are going through the same thing, and suddenly everybody's separated and everything, is gone. So building those networks.
Exactly, and interestingly enough, we see that as a problem because we can see people transition from doing okay to not doing okay. But unfortunately, far too many people in this country, including African American youth, including the LGBTQ community, including Native American and Indigenous persons, feel disconnected all the time. They don't have any point in their life when they feel like they're part of a community, they have purpose, they have control in their lives. And so we need to understand that what we're seeing happen in the military as people transition into being veterans is a state that exists for far too many people all the time.
Well, what about the increase in social, we talked about social, another point that you raised in your report, the increase in social connectedness and support, identify and support people at risk. We talked about veterans, we're talking about the Black community, we're talking about LGBTQ. I mean, how are we doing in all of these groups so far? Well,
we have more data than ever on who is at higher risk for suicide. And so it's important that we take that data and implement programs, targeted programs to those communities. As you mentioned, the LGBTQ community, we know those individuals are at particularly high risk, especially here in Indiana, to feel isolated, to feel stigmatized, to feel like they don't have a community. And so we need to be particularly aware when they're exhibiting signs and symptoms of mental health issues or of suicidal ideation, and we need to target programs to those at-risk groups. We're doing a better job of it, but we need to continue to focus efforts to at-risk communities.
What about support lethal means safety? What do you mean by that? And in your report, as I'm talking about, what are you talking about in your report?
Well,
is this gun protection and when people have guns in their household, and I mean, is that what we're talking about here? And
well, it's important to know that for every one person who dies by suicide, there are thousands of people who have suicidal ideation or who make a suicide attempt. And so what we want to do is not just prevent people from dying by suicide, the 1.4 million people every year who actually die by suicide, or who actually make an attempt, but we also want to intervene where we can. And we know that 90% of people who attempt suicide using a firearm are successful. So understanding that is incredibly important. Studies show you have about 10 minutes between when a person decides they're going to take their life and when they actually make the attempt. And if you can separate them from a lethal means during that 10 minutes, you can actually break the cycle and lower the chances that they're going to try to take their life. Many people think and they'll just go and try it another way. That's actually not true. The data we have shows us that if you can separate them from lethal means during that critical time frame, then that increases the chances that they will not die by suicide in the future. So one of the recommendations we make in my Surgeon General's report is that we promote lethal means safety. And I want to be clear, guns and any conversation about guns is controversial. This is not about taking guns away from people. It's about helping people understand, look, you're at risk for suicide. You own a firearm. If you're starting to have these signs and symptoms or have these feelings, maybe give your gun to a friend. Even something as simple as storing your firearm in a different place than your ammunition and having them both locked up creates that time so that you actually can think through and say, okay, I really don't want to do this, as opposed to just picking up the loaded gun that's sitting out on your dresser and it taking your life.
That is such a great point. And I'm thinking also, since we were talking about young teenagers before, if they have the household parents or have a gun and the ammunition is in one place, but the firearm was locked up in another place, and that 10 minutes, so much can happen. It sort of doesn't just go from there to there so quick.
Exactly. Three main ingredients for a successful suicide attempt. Number one is a crisis. So we want to identify, it's at-risk people, but then they have a crisis, and then there's often alcohol or drugs involved, so they're in an altered state of mind, and then it's easy access to lethal means. So I'm someone who for whatever reason, I'm at risk, and I get yelled at, I lose my job, I break up with my spouse. I have that immediate crisis, and you go out and you drink a little bit too much, or you smoke some marijuana, and there's a gun laying around, a loaded gun. So anything that we can do to disrupt that pattern will lower the chances that someone actually dies by suicide.
And then how are we doing in terms of, we talk about we need support, we need networks. How do we get people to go seek help and support and care when they're experiencing these suicidal thoughts? I mean, we talk about the difference between mental wellness and mental illness and the stigma. And I also think you have to be very careful of it's so brave for someone to come out and say, I'm struggling. And what if you are just shut down by that person that you thought you could go to, or that loves you and that loves you, but it's just like, I don't know, maybe doesn't have the same understanding, and, kind of finding your helper. So the very first conversation when someone comes out and says, I'm having trouble, could sort of either have the conversation, help the conversation keep going and help them get to the help that they have, or really they can just shut down and be like, that person says I'm nuts. What am I going to do? Maybe I'm nuts. So, I mean, I don't know if there was a question there. I'm kind of thinking out loud here with you, but.
No, finding your helper is so incredibly important. And one of the things that we try to encourage is that everyone have a support system and understand who they will go to if they're struggling. And that's anyone, whether you're at risk for suicide or think you are or not. It's important to have someone you can reach out to and talk through issues with when you've got stress in your life. That may be your church group. That may be a family member. That may be a spouse. It may be any number of other ways that you can connect out there. But it's important as an individual to know if you have those folks out there. Number two, we have to understand that we may be the helper that someone's coming to. And so it's important for us to be educated about suicidality and to understand that it's not a sign of mental illness per se, that most people who attempt suicide have not been diagnosed with a mental illness and don't have a mental illness. So we need to educate the public about suicidality. We need to educate them about the signs and symptoms and educate them about particular groups who are at risk so that you can be a good helper. And then we need to lower stigma. And we've worked with athletes. Simone Biles has talked very much about her struggles with mental health. And that's been incredibly empowering for people across the country who maybe wouldn't have stepped up and shared their feelings before. So lowering stigma, increasing the receptiveness of people who are potential helpers, and then helping individuals identify all the people in their lives who they either have or might have who can be their helper. Important for people to know that we have a new suicide hotline, 988. Because no matter how hard we try, not everyone is going to have that person who they can identify, but we want them to at least know there's a number they can call to talk to someone if they're struggling, if they need someone in their lives to just really open up to.
I want to go back to, you talked about Simone Biles and how she came out with her. I mean, she, Olympic athlete, decided not to compete in some of the events because she was struggling with her mental health. What role do public figures who come out with their mental health struggles have? They can have a huge influence on kids. I mean, some for better or for worse. I mean, I think Simone Biles is a great example. A lot of girls, athletes, black young girls look up to her in that way, and have someone they can identify with as well. But then we also have on the other end, when Kanye West came out, who was seriously struggling, he got a lot of backlash from people, and people have sort of brushed him off as being someone who's not my words, but a lunatic. So what role or responsibility do these individuals play, and how do sort of parents monitor the way in which their children see these people in terms of if they have who have a mental health struggle, and what is their role, let's say? Well,
you talk about celebrities like Simone Biles, like Naomi Osaka, like Kanye West. I think the more these individuals share their stories, the better it is overall for our ability to have open conversations about mental health and wellness. And young people nowadays are way more willing to talk about their feelings than what people my age, or certainly people my parents' age, are willing to. So we are moving in the right direction, and I think that is a testament to both the openness of young people and the role models who they look up to nowadays being willing to talk about these issues. It's interesting you talk about Kanye West and Simone Biles, two different mechanisms in some ways for being at risk for suicide. Simone Biles in a high-pressure job. A black female, someone who for multiple reasons, may feel like she can't talk about her mental health issues. Kanye West, someone who's been open about the fact that he has mental illness, and you see that sometimes manifest in ways that can be harmful to him. I think they can be role models for different groups of people out there in helping them understand that, hey, I'm more like Kanye West. I have a identified mental illness that I need to see a doctor for, and sometimes just like your blood pressure gets a little high because you went a little crazy at the family dinner, and ate too many collard greens with too much salt in it. Maybe you're having a mental health issue at the moment related to your mental illness, and that's okay. It's okay for Kanye West. It's okay for me. Or you say you're in a high-stress job like I was in, and you see a Simone Biles out there, and you can see that she's stressed, and she said, okay, I need to take a break, and she took a break. And that helped other people, I think, across the country realize it's okay to take a break.
That was so brave. That was such a wonderful example of someone taking a break when they needed it. An Olympic athlete, imagine. I mean, I was just floored by that. And
if
so
she can take a break from the Olympics, then any of us can take a break at any time. I mean, she literally gave the entire country, and particularly young black girls, permission to take a break.
That's extraordinary. Yeah, absolutely. What a wonderful, wonderful young woman. I want to also talk about where are we going? What needs to be done? How much progress have we made? I mean, I know I say, has there been made? I mean, it's so multifactorial. So it's hard to quantify in ways, but I mean, where do we go from here? We're not there yet. We're seeing this as still being a crisis. Who are our players? What needs to be done on certain sort of the individual level, community level, national level?
Well, so we need to understand that we all play a role as community members, as family members, as educators and employers, as support groups. We all can play a role. We all can be that reason in someone's life that they decide not to take their life, or that they're not successful in taking their life. Or conversely, if we're not educated, if we're perpetuating stigma, we quite frankly can be the reason that someone does take their life. So we all have a role to play. When I put out my call to action on suicide prevention as Surgeon General, one of the things I emphasized is we have a lot of knowledge about how to prevent suicide. A lot of people think that there's nothing you can do. No, there's a lot of evidence out there that tells us we can break the cycle, but that call to action was really calling on people to take the steps that we know work to prevent people from dying by suicide, again, such as lethal means safety, such as lowering stigma, such as encouraging insurers and employers to pay for mental health services so that more and more people have a physician or a behavioral health professional who they can talk to. So I think we're moving in the right direction from a mental health standpoint. We're at a time of unprecedented stress for many communities, and it's really put a spotlight on things like suicide and opioid overdoses. But I'm heartened by the fact that we're having conversations like the one we're having today about what people can do so that we normalize the discussions that I think need to happen.
Absolutely. Anything else that I missed that you want to talk about?
I think we covered it all. We had a wonderful conversation, and talk through everything that I wanted to talk to. What I want people to know is that suicide is not inevitable in certain people. We can break the cycle, and if we break the cycle, then there is really good evidence to tell us that people won't go on to attempt suicide again in the future. So I want them to know that like any other health issue, again, like high blood pressure or diabetes, if we identify the people who are at risk and identify the risk factors and then treat it the way we would treat any of these other issues, that we actually can put more people on a pathway to avoiding suicide versus continuing to see some of these unfortunate trends in communities at risk.
It's just last question just got me thinking about judgment, stigma. Do you think people are some people are judging themselves or afraid of judgment from others? I just want to get your perspective on that. Judging yourself versus with having a problem perhaps, or being afraid of being judged by others?
Well, judgment relates back to stigma. And there's a stigma against saying you have mental health issues. And so sometimes when you say I'm anxious or depressed, you feel guilty admitting it. But other times you say it and people will shun you for saying it or say, pull yourself up by your bootstraps. So I think it's both. I think we have to talk about these issues so that people don't feel guilty themselves any more than they would feel guilty saying, I broke my ankle. But we also have to make sure there's a loving and accepting environment around them who also sees that broken ankle as not the fault of the individual and doesn't see making a suicide attempt as the fault of the individual, but rather a confluence of risk factors that came together that we actually can disrupt such that these people can go on and live long and healthy lives.
Thank you.
Absolutely. Thank you.
This has been Medical Minutes from Wish TV. I'm medical reporter Dr. Mary Gillis. Be sure to follow and subscribe to this podcast and check out new updates every week. You can also learn more at wishtv.com and when you follow Wish TV on Facebook.
This is the Medical Minutes Podcast with Wish TV's Dr. Mary Gillis. Be informed and stay connected for the latest news and information when you like, subscribe, and follow this podcast. And discover even more from the All Indiana Podcast Network. Now at allindianapodcast.com.